Let's now go into components of a safety statement. Every safety statement must include the following three main aspects. 1. The introduction. This aspect contains the organization's aims and objectives for formulating the policy. The organization takes time to explain and elaborate upon the reason why it wants to formulate a safety policy. Of course, and the major reason why every organization has to have a safety policy is to establish and to ensure the safety of its employees and visitors and those who work as agents within their organization. That's basically the undertone of the preparation of any safety policy, apart from the fact that it is very cost effective and also it keeps the organization in line with governmental policies and governmental rules and regulations. 2. Duties and responsibilities. Who is responsible? Now, in every safety statement, this is one aspect that must be well established. Whose duties and responsibilities it is to manage and enforce safety and health policies in the organizations. Of course, the employer is the primary bearer of the responsibility of ensuring the health and safety in the workplace. But for efficient implementation of the policy, the employer must assign responsibilities and authorities to his subordinates, who are the stakeholders in the implementation of the health and safety policy. Now, number 1, employer. The employer is the number 1 person that is responsible as far as the health and safety of those under his employ are concerned. It is his duty to make sure that their safety is guaranteed to a maximum level and to make sure that every emergency possible is effectively handled. Then he can decide to devolve those responsibilities to his subordinates, who also he must hold very accountable to make sure they deliver the goods. So the names and responsibilities of these stakeholders must be well elaborated, must be clearly written out in the safety statement. The responsibilities of the manager, the responsibilities of the management staffs, and those of the workers must be clearly spelled out in the health and safety statement. The above must be in order in the form of an organizational chart. You actually see a very good safety statement. You would find a chart like table or something like that that draws down a kind of an organogram, how the order of responsibility from the employer down to those, the tributaries, to those who are responsible for one safety duty or the other. So the above must be in order of an organizational chart, which states the hierarchical order of the health and safety management structure. The name, job title, and responsibility of every key personnel must be well stated in the health and safety statement. That is how it is supposed to be. Number 3, application. In this part, the company defines the jurisdiction of the policy and to whom it will apply. jurisdiction of the policy. This policy, that policy, which department does this policy belongs to? Which staff, which part of the organization does this particular policy refers to? That must be clearly defined. So there shouldn't be any ambiguity at all when it comes to the definition of the jurisdiction of any policy at all in every or a safety statement of any organization. So when somebody picks up your organization's safety statement, he should be able to know exactly, okay, this particular employee that is in this particular department that carries out this particular duty, this is how he or she is supposed to operate his duties and how he or she must not operate his duties or her duties. That is what application is all about. Number 4, reporting. Of course, a good health and safety statement must have a clear stated procedure for reporting health and safety incidents and accidents within the organization. In cases of events, in times when things happen, of course things happen, accidents happen, incidents happen. How do you report such cases? There are laid down procedures for such to be done, how to report cases in times as that. So those procedures must be well known by those in any department at all, the employees involved in any activity at all in the organization. They must know how to report the cases or the events as effectively as possible. Emergency plans. A health and safety statement must also have clearly stated methodologies for handling emergency situations, especially when they occur. Of course, when they occur, we shouldn't wait until there is an emergency. Then we begin to scratch our head. Okay, what can we do now? What? No. Beforehand, before the statement is written, before the safety statement is written or was written, we had already envisaged, okay, this could happen, that could happen. Now, in the situation where it eventually happens, what are the methodologies? What are we supposed to do to be able to handle efficiently and effectively that situation? In the case of fire outbreak, what can be done? What is the nearest exit points? What are the back doors out of the place? What are the channels through which fire extinguishers can be brought in to be able to handle the fire incidents and all that? What are the procedures on ground? That is what we're talking about here. That's the emergency plans. Examples of cases like cases of emergency are death or serious injuries as a result of work activities, gas leak, natural or medical gas, flooding, in cases of bomb threats, case of violence and aggressive people. How do you handle them? What are the emergency plans? It must be well stated. Sharp injuries, child abduction, radiological exposure, biological risk. In these situations and many other more, what are the possibilities? What can be done? What are the laid down principles that must be followed towards handling the situation? That is emergency plan. Another aspect of emergency plan is to be able to continue delivering services while emergency situations are being handled. So every organization should be able to learn how to continue to carry out their responsibilities even if they are under an emergency condition. For instance, in a hospital setting, there must be a clear plan for continuous attendance to patients should there happen to be an emergency situation that demands a cessation of full operation. Yes, there is no full operation is no longer ongoing, but there are critical patients. Do you now close down the hospital totally because there is an emergency? What now happens to those critical patients? What now happens to the babies in the incubator? Let's say that there was a total blackout in the hospital, like the situation that was reported not long ago in a particular medical facility in Port Harcourt, a tertiary institution. And we heard that multiple babies died. Babies that were in the incubator died because there was no emergency plan whatsoever. There was total blackout in the hospital, in a tertiary hospital. Babies died, and that is actually the one that you heard about. What of other patients that were in critical conditions? What of those who were dependent on oxygen, that were on ventilators and all that? And of course, you need electricity to be able to power those things. What happens to them? What happened to them? So every organization, hospitals, healthcare facilities must have emergency plans well established and ready to go in case of any emergency whatsoever. And such facilities to be able to continue being in service, at least to some level, catering for those who are critically in critical conditions, even when the whole of the facility is not operational. In situations like, we can, of course, there could be shifts and all that, plans for shifts. All the staffs may not be coming in at the same time, but of course, shifts, plans like that should be in place. Again, the importance of emergency plans, we saw it well expressed during the COVID-19 outbreak. People were told to sit at home, right? There was total shutdown of activities, total shutdown, but there were critical sectors that were open, especially the medical sector. That was how you could actually see emergency plan at work during the time of the COVID-19. Number 6, continuous education. Now, you wouldn't say that because there is a safety statement, therefore the work is done. No. After safety statements have been written, safety policies have been established or written out or drafted, it is now a responsibility of the employer to train and retrain and keep training the employees in the organizations on what their duties and responsibilities are as touching health and safety matters in their different areas of work. You can never overemphasize this. There must always be the often education and re-education of staffs about health and safety measures, especially once every year, maybe during special occasions. The continuous education plan must also put visitors and new personnel into consideration when there is recruitment of new personnel, or when interns are being inducted into the facilities. As far as these are new people coming into the facilities and they will be doing some works in the facility, there must be the educational induction of those people into the safety policy plan of the organization. You don't just bring them in and then you just usher them into the organization. No, you have to groom them and train them and expose them to the safety plan of the organization so they can become aware of it and then work alongside the rest of the organization. Number 7, monitoring and improvement. The health and safety manager must continue monitoring the implementation of the health and safety plan with the intention of identifying and effecting further improvements. This is mandatory. We have a situation where, of course, you tell people, test house, this is what must be done, this is the procedure that must be followed in doing things in this organization. But once there is no supervision, once there is no monitoring, and they get the sense that nobody is monitoring what is happening, things will fall apart. Things will fall apart. People want to be monitored. People must be monitored if you must get them to do what is right. And this monitoring must be strict. They have to know that if they are not following through the guidelines, then they are certainly going to be sanctioned. Once they know this and they know that eyes are always on them, they will be very serious with the safety, the health and safety policy that have been put into place. Of course, monitoring is in two aspects, active and reactive monitoring. As the names imply, active monitoring involves taking precautionary actions before things go wrong. While the manager, the health and safety manager, is going about his duties, the scientist will see this is not right, that is not right. It is not supposed to be done like this, it's not supposed to be done like that. That is active monitoring. Get this thing corrected right now. You don't wait until something has happened. He immediately sees that and proactive actions are taken to curtail that event from boiling over. That is active monitoring. This involves actions like regular inspection, taking audits, inspection feedback, or employee surveys. Yes, you can survey employees. What do you think can be improved upon? What do you think can be done? Okay, we've been working with this. Is he efficient? Is he working well? Can we add anything? Is there anything you think we can add? You ask questions, you take feedbacks from the employees. Of course, employees are the ones who could give you better insights on whether things are working or not. They are the ones in the forefront of the whole issue, so they can give you a better understanding of whether it is working or not, so you can be able to do a very good analysis of the whole issue. Now, reactive monitoring, this is, on the other hand, actions that are taken after things had gone wrong. Yes, you are reacting to events now. The emergency had happened already. So how can we handle it? What can we do now to effectively take control of this thing before it becomes something beyond our control? So this involves the study of accidents and learning from the mistakes in order to prevent a repeat. That is monitoring. Number 8, review and update. See, because every living organization evolves over time, it is therefore necessary that health and safety statements of organizations be regularly reviewed and updated so as to accommodate the recent changes that had occurred within the organization. Except that organization is dead, but there is no organization that is alive that would not evolve. And if that organization is evolving, then the safety statement, the health and safety policy of that organization must also be evolving. It must be evolutionary. Are you getting this now? Because certain things must have been added to the organization. Certain working tools must have been brought into the organization. Certain responsibilities must have been added into the organization. So the safety policy of the organization must put into consideration those new introductions into the organization, so that the safety policy can cover those new additions to the organization. Hope you're getting what I'm saying here from in this aspect of the study. This review and update could be done once a year, or as often as there are changes within the organization. For instance, if there are new materials, equipment, or systems of work, like I said earlier, that has been introduced, then the health and safety statement must be redesigned to accommodate the said changes. In the process of that, new government legislations or any other relevant information must be well considered. Yes, while renewing your safety statements, also put into considerations probably new legislations that the government had put into place to help put the health and safety of employees as a paramount aspect of work in your organization. I think this is very clear with regards to this aspect of the components of a safety statement.